At week 7 of pregnancy, you're still in the early stages of your first trimester, but significant developments are happening with your baby. Here's what you can expect during this week, along with general do's and don'ts to follow throughout your pregnancy. Fetal development at week 7. Size and growth. Your baby is now the size of a blueberry, measuring about 0.5 inches, 12 millimeters in length. Although still tiny, your baby is growing rapidly. Major developments. Heart. Your baby's heart is beating at about 90 to 110 beats per minute and is becoming more rhythmic. Brain and spinal cord. The brain is developing quickly, and the neural tube, which becomes the spinal cord, is closing. Facial features. The beginnings of facial features, including the eyes, ears, and nose, are forming. Limb buds. Small limb buds are developing, which will eventually grow into arms and legs. Common symptoms at week 7. Morning sickness. Nausea, with or without vomiting, is common due to increased hormone levels, particularly HCG and estrogen. Fatigue. You may feel unusually tired as your body works hard to support your baby's development. Breast tenderness. Hormonal changes can make your breasts feel swollen, tender, or sore. Frequent urination. The growing uterus is pressing on your bladder, leading to more frequent trips to the bathroom. Food cravings or aversions. Hormonal changes can cause strong cravings or aversions to certain foods. Mood swings. Hormonal fluctuations can also lead to emotional ups and downs. General do's and don'ts during pregnancy. Maintaining a healthy lifestyle during pregnancy is crucial for your well-being and your baby's development. Here are some general guidelines to follow throughout your pregnancy. Dose during pregnancy. Take prenatal vitamins. Why? Prenatal vitamins provide essential nutrients like folic acid, iron, calcium, and DHA that support your baby's development and help prevent birth defects. What to do? Start taking prenatal vitamins as soon as you find out you're pregnant, or even while trying to conceive. Eat a balanced diet. Why? A well-balanced diet ensures you and your baby get the necessary nutrients for growth and development. What to do? Focus on eating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Include foods rich in folic acid, iron, calcium, and fiber. Stay hydrated. Why? Proper hydration is important for maintaining amniotic fluid levels, supporting digestion, and preventing dehydration-related issues. What to do? Drink plenty of water throughout the day. Aim for at least 8 to 10 glasses of water daily. Exercise regularly. Why? Regular exercise can help maintain a healthy weight, reduce stress, improve sleep, and prepare your body for labor. What to do? Engage in low-impact activities like walking, swimming, or prenatal yoga. Always check with your healthcare provider before starting any new exercise routine. Attend prenatal appointments. Why? Regular checkups allow your healthcare provider to monitor your health and your baby's development and address any concerns. What to do? Schedule and attend all prenatal appointments, including routine tests and screenings. Get plenty of rest. Why? Your body needs extra rest to cope with the physical and emotional demands of pregnancy. What to do? Aim for 7 to 9 hours of sleep each night. Use pillows to support your body and find a comfortable sleeping position. Practice good oral hygiene. Why? Pregnancy can increase the risk of gum disease, which has been linked to preterm birth and low birth weight. What to do? Brush and floss daily, and visit your dentist for regular checkups. Manage stress. Why? High levels of stress can negatively impact your pregnancy and your baby's development. What to do? Practice relaxation techniques like deep breathing, meditation, or prenatal yoga. Take time for yourself and do activities that help you relax. Don'ts during pregnancy. Avoid alcohol. Why? Drinking alcohol during pregnancy can lead to fetal alcohol syndrome and other developmental issues. What to do? Completely avoid alcohol throughout your pregnancy. Don't smoke. Why? Smoking increases the risk of miscarriage, premature birth, low birth weight, and respiratory problems in the baby. What to do? Quit smoking as soon as you find out you're pregnant. Seek help from a healthcare provider if needed. Limit caffeine intake. Why? Excessive caffeine consumption has been linked to an increased risk of miscarriage and low birth weight. What to do? Limit caffeine intake to no more than 200 milligrams per day, about 1 12-ounce cup of coffee. Avoid certain foods. Why? Some foods pose a risk of foodborne illness or contain substances that can harm your baby. What to avoid? Avoid raw or undercooked meat, eggs, and seafood. Unpasteurized dairy products, deli meats, and high-mercury fish like shark, swordfish, and king mackerel. Don't use certain medications. Why? Some over-the-counter and prescription medications can be harmful to your baby. What to do? Always consult your healthcare provider before taking any medication, including supplements and herbal remedies. Avoid hot tubs and saunas. Why? High temperatures can increase the risk of neural tube defects and other developmental issues. What to do? Avoid hot tubs, saunas, and other activities that can raise your body temperature to unsafe levels. Don't skip meals. Why? Skipping meals can lead to low blood sugar levels, which can make you feel dizzy or weak. What to do? Eat small, frequent meals throughout the day to keep your energy levels stable and provide consistent nutrients to your baby. Avoid contact with harmful chemicals. Why? Exposure to certain chemicals, such as pesticides, solvents, and some household cleaners, can be harmful to your baby's development. What to do? Use natural or pregnancy-safe cleaning products and avoid exposure to harmful chemicals whenever possible. Limit high-impact activities. Why? Activities with a high risk of falling or abdominal injury can be dangerous for you and your baby. What to avoid? Avoid activities like skiing, horseback riding, or contact sports. Opt for safer, low-impact exercises instead. Conclusion: at 7 weeks pregnant, your baby is undergoing significant development, and you may begin to experience more noticeable pregnancy symptoms. Following the general do's and don'ts during pregnancy can help ensure a healthy and safe pregnancy for both you and your baby. Always consult with your healthcare provider if you have any questions or concerns about your pregnancy, and take care to listen to your body as it changes and adapts during this important time.